Hmm. We are live now. Okay. We are live now, sir. Hello, everyone. Good evening from India. I'm Dr. Nazneen Pathan, physiotherapist and the moderator of our today's session. I welcome you all in Global Outreach Physiotherapy Webinar 2020, which is hosted by Global Outreach Medical and Health Association, which is an organization representing medical and health professionals. It promotes and provides accreditation, certification, educational training, and other resources for organization, professional, and student. I would like to thank our CEO, Mr. Rakesh Kumar, and our co-founder, Dr. Jasmine Marwaha, who has been working so hard for the upliftment of our platform. Since our platform has been quite privileged of having so many astonishing and knowledgeable speakers, and for our today's session, we are having Dr. Dharmesh Kubendiran, who will be enlightening us on the topic of Marma Therapy. Welcome, sir. Before we proceed, I would like to address all the viewers to please check the description box of the speaker's schedule for participation and certification. Before we proceed, I would like to give you all a brief introduction of our today's speaker, Dr. Dharmesh Kubendiran. He is an BMS doctor, BS, MSc, and MPhil in sports biomechanics and kinesiology, PhD in sports method and training, sports rehabilitation from Europe International Wellness Institute. He is certified dry needling specialist, certified diversified chiropractic and osteopath specialist, assistant professor, sports therapist at National College. He has more than 19 years of experience in treating sports injury, offers sports medicine, consultation, and training for clinician practitioners, trained in broad and comprehensive range of manipulation modalities that are integrated into a global treatment session. Worked 3 years in Canada and have in-depth knowledge of native medicine and sports medicine. The majority of these modalities focus on sports soft tissue and joint manipulation, involved with research and practical knowledge of sports biomechanics and sports kinesiology. They include counter strain, muscle energy, HVLT, and myofascial release, trigger point dry needling, and stimulation through dry needling. Sir has done more than 350 workshop training sessions in India, Canada, Malaysia, Singapore, Mauritius, Dubai, and Bahrain. By addressing the cranial and visceral internal rhythm and motion, in addition to the muscular and skeletal system, a far greater and deeper level of health can be achieved. Always been an educationally lecturing, learning for the lifetime. Sir is also a chief consultant at Jogo Health US EMG Biofeedback Clinic in USA. He's assistant professor at sports therapy at Research Department of Physical Education and Sports Science National College, a chief sports kinesiology consultant and sports therapy consultant. He's a chief pain management consultant at Resident Indigenous Practitioner, chief sports therapy consultant at Jalnawala Sports and Wellness Private Limited, Navi Mumbai, and he is a chief sports therapy consultant at an Taekwondo Institute, Navi Mumbai. Hello, sir. I welcome you on behalf of Global Outreach Medical and Health Association. And with this, I over it to you. The platform is yours.
You able to see, ma?
Yes, sir.
You start?
Yes, sir.
Good evening, everyone. This is Dr. Dharmesh from Chennai, India. Uh, Thanks, ma'am. Thanks Global Outreach and thanks Rakesh and the team for introducing me and giving me this platform to share my knowledge on Indian system of manipulation and traditional manipulation. Marma therapy. It is a manipulation therapy. It does not have a limitation in manual and manipulation therapy. It has a wide range of scope in organ visceral manipulation and organ systems and fracture management and dislocation management. First, we go through the history. History of traditional manipulation. In Indian system, we have three kind of main important manipulations like Varma therapy mentioned in Siddha system of medicine, 500 BC Agastya. He has mentioned 108 vital points. Marma mentioned in Ayurvedic medicine by Sushruta, father of surgery, at 300 to 600 BC, 107 vital points he has mentioned and given more elaborate description about Marma and surgical points. Kalai, it is in 1362 AD, masters of all martial arts from ancient South India. It's explained by Parashurama and Agastya. They mentioned 365 vital point and different school of thoughts, like they have like 400 plus vital points. See, two school of belief and two school of treatment happened. One is medicine and another is surgery. Father of like medicine is Hippocrates and father of surgery is Sushruta. You see both of them, they both believe in natural healing process and natural healing energy. What is the natural healing energy? The natural healing energy which heals us, which makes us to do our routine life, and it's the most important thing. Being a surgeon, being a physician, they both believe in natural healing. Hippocrates in his work, he has documented more about spine manipulation, making a person using gravity and tie the person in the ladder and using many leverages to the joint like manual and manipulation techniques. In this side, if you see like Sushruta, 600 BC, he explained Marma and manipulation, including fractures, dislocation, and he is the person first documented about cupping therapy too. Just we go through the small bio about Sushruta. With this picture, you can see like he was dissecting a body, and then he is the first person to document about anatomy and dissection. Sushruta, father of general surgery, plastic surgery, and reconstruction surgeries. First person to document on human dissection to teach anatomy. Explain Marma vital points and the surgical importance. He has mentioned 107 vital points. He mentioned 12 varieties of fractures and 6 dislocation types. The principle of traction, the methods he used is we see more elaborately in upcoming slides. Also, he used wine to dull the pain of surgical incision, described 20 varieties of sharp instruments and 101 types of blunt instruments used for surgery and their handling techniques. He is the first person to use the needles for the surgery purpose and to immunization. The dry needling, golden needle appears into the ears of the baby, and also for incision and drainage, he was using the needles. Rhinoplasty, 15 different types of osteoplasties, classification of burns into 4 degrees, heat strokes and frostbites. 14 different types of bandages for dislocation all over the body. This ear boring ceremony he was doing in the 6th month of for the baby, just to protect and then to create the immunization and also for the decorations. The main concept, Marma Therapy. We see that all the techniques explained in Marma Therapy, if you see, all are just spacing the joints and stimulating the structures. If you have any blockage, why the spacing a joint is most important. I'll come back with more elaborate what traditionally they are meant in the literature and medical books. First, we see about Marma. Marma is the meeting point of muscles, bones, ligaments, nerves, joints, and blood vessels, where vital force prana resides. That is called as the Marma point. These are the four major techniques explained by Sushruta in his books on the manipulation and treatment and healing. First technique is traction and manipulation, opposition and stabilization, and immobilization. We'll come back to this again. In medical Marma therapy, like a total package of Marma therapy, we have two different techniques. The main is Adangal therapy. So, as explained by Agastya, this Adangal therapy is immediately after injury, 98% you don't use any medicine, and then we have many contraindication, and then select the patient to do this. It is as a first aid management. Medical Marma therapy has involved with medicines also together. Some we don't use medicine, some we must use medicine, and then together we achieve a lot of relief with the manual and manipulation therapies and stimulations. We see the Indian traditional system of manipulation. There is an Adangal rule, the Siva Parvati Tattvam. If you see in applied kinesiology, when you treat the left side, you have to treat the right side. When one side of the muscle is shortened, another side of the body muscle is stretched. So we need to treat both the side. If you see the sports rehabilitation, overuse muscle, underuse muscle, you need to train both. So in the traditional system, they say that we have to apply the manipulation or stimulation and then get the balance. When the energy is blocked, we need to get the balance with the four major techniques that are traction, manipulation, opposition, stabilization, and immobilization. Immobilization is the bandaging method, which is the most important method after the alignment, bandaging the region and then resting that, it enhances the natural healing. In another like Adangal technique, and then in Siddha system, we have 108 vulnerable points and anti-vulnerable points. For the first aid management, there are 64 points. This is the Hippocrates quotes to get the knowledge of the spine, the requisites for many diseases. See, both of them, like traditional way in our system, and Hippocrates has mentioned that spine and disalignment is the most important thing. We see like what are all the importance and what it was explained, and then how it derived. Marma therapy has its roots from Ayurvedic system of medicine and Siddha system of medicine. It is documented in Sanskrit and Tamil language. Sushruta and Guru Agastya did contribution. These contributions in a medical text. Marma therapy is joint spacing therapy with bandage techniques for dislocation and fracture management. This is the in all the manual and manipulation therapy. This has a very powerful manipulations for the management of dislocations and fracture management. Also, we have several points mentioned for visceral manipulation with internal medicine to heal the system, and with internal and external medicine to heal the system. These are the points You see, like this point directly will be like on the diaphragm and the rib and hridaya, nabi, and basti. You see this point mentioned the Vilnuvarmam, it is a sacroiliac joint and L5S1 and T12L1, and all these points mentioned are for the trunk and abdomen, which connects to the different level or organ through the system. You see this one, Kadikatarana, this point, it is like ligament of the sacroiliac ligament, and this connects with the fascia and trapezius muscle, and this with the thoracolumbar region, the sacroiliac thing, and the pubic symphysis, this point. And then this one connects directly to the facial points. All these points are like for the cranial manipulations. Adipati is a powerful point, and this one is open from the frontal bone. See, this one is all like we can separate the head, cranium, and 8 cranial bone and 14 facial bones all together. We are mentioned in this vital point. It comes under the vital points. The usage, it is useful in misalignment, dislocation, fracture management, acute and chronic pain management. Also in hormonal imbalance and systems like reproductive system, digestive system, circulatory, etc., nervous system, with manipulating points with the medicines internally and externally. It has separately manipulation of muscles, bones, joints, ligament, tendons, blood vessels, and individual organs. This marma comes under the Ayurvedic system. If you want to have a fantastic treatment and you want to give a very good treatment for your patient, understand the cause, then the problem and the symptoms. If you cannot able to understand the cause, then it is not easy for the physician to treat the symptoms or the disease or the syndromes or etc. The cause is the most important thing, because cause will be sometimes deep rooted. For this, Ayurvedic nosology has mentioned Nidana Parivarjana Samprapti Vigadanam. What it is mean? Nidana, etiology, Samprapti, pathogenesis. Etiology and pathogenesis. When we treat this, the physician ascertain of the source of the disease would help him prescribe a line of treatment that would eliminate the symptoms, not only eliminate the symptoms, but also correct the defect at the source. So, treating the cause, the pathogenesis, also the most important. There are 6 stages. The differential diagnosis is the most important. These are the 6 stages of the diseases, and you can achieve the target. If you prevent the cause only, you can prevent all this accumulation, aggravation of the diseases, dissemination, localization, manifestation, and explosion. All this can be prevented only if you find the cause properly through proper differential diagnosis. The concept of treatment, when it goes to the Marma Therapy, the concept, we take the concept from the Ayurvedic medicine, whether to find the disease is endogenic, is through the metabolic disorder, or exogenic, or like traumatic. The treatment will be internal, external, or surgery with manual therapy and manipulation therapy. What is the understanding of manual therapy is like when we generally move the joint, the body get its own alignment. It is a kind of manual therapy. In manipulation therapy, the therapist specifically see the misalignment or the dislocation and give the force vector in a particular direction just to align. This is the difference which was explained for used in dislocation fracture joint alignment management. It was documented by Sushruta. So if we see that the physiology, the science behind alignment, like modern system has so many alignment, neurophysiology, biomechanical disturbances, and then principle to align. And Indian system, we see our body is the bone is the channel of flowing healing energy. The bone, when the bone are misaligned or dislocated, we will get chronic pain. When we realign, the pain goes immediately because the healing energy was blocked when there is a misalignment or dislocation. So there is an example, Ayurvedic example. Our body is made up of 5 element principle with Atma. It's a prana, living body. When we die and the Atma escapes, it's a dead body. What happened 3 weeks? The nails start fall. 4 weeks, the hair start decay. Brain melts vigorously. 6 weeks, the stomach melts and to the private part. 15th week, the bone remains. The bone remains because it is channel of healing energy. We see that when there is as we say, the applied kinesiology, the head is connected to the spine. The spine is connected to the pelvic girdle and scapula. All these connections. That in Ayurvedic principle, there is a Trikasanti, 3 joint principle. All this ilium bone, 2, and the sacrum. This junction is the most important for the stability. Same thing here with the scapula, clavicle, and the chest bones. It has to be in a proper alignment. So this is the Trikasanti. You see the Siddha system of medicine, they have said 5 junction. Like C1, this is called as the Karunamrta Mudichi, Sara Mudichi C7 T1, and another is T8 T9 and T12 L1 and sacrum. Okay. What's the most important thing in this? When we treat this C1, in the out of 108 points, we can manipulate certain group of points. See, when you treat the C1, you can able to treat 32 points. When we treat the junction of C71, you can able to treat 15 points. When we can able to treat the T8 and T9, 41 point, and T12 and L1, 10 points, and sacrum, 10 points. So altogether, 108 points according to Agastya school of thoughts. Our body will get blocked through the muscular injury. When there is a strain, grade 1, grade 2, grade 3 tear, and the adhesion tissues formed, there is a shortening of muscle. So manipulation of muscle will be releasing the strain on the joints when the muscle get released. So this also is the most important thing. Bone is a channel of healing energy. See, when the muscle get grade 1 or moderate mild tear, this can be healed by itself. This complete tear needs surgery, and same thing happens in the ligament also. Complete tear needs the surgery, and in condition of dislocation, when it is anteriorly dislocated, posteriorly or inferiorly, this dislocation, we feel more pain The pain reduces only after reduction technique. Either we do surgical reduction in the advanced stages or even a manual or manipulation therapy. We don't need medicine because we are putting back the bone so the healing energy part takes its way and the pain disappears immediately. Same thing happens in the fractured bone also. When the bone is cut into pieces, there is a chronic pain, even fainting, many things, many signs and symptoms will happen when there is alignment. Sushruta has explained, elevated bone has to be depressed, depressed bone has to be elevated, and then bandaging has to be done. Immediately, you don't need any medicines. Immediately, the pain will subside after in certain condition of fractures. So, the bone is the healing energy. The bone, through the bone, the healing energy transfer, and so the alignment is most important. Bony misalignment, joint blockage. To relieve joint blockage and alignment of the body, Sushruta explained four major techniques. As I mentioned earlier, the four techniques in the when he was describing the natural healing and dislocation and fracture management. These are Anchana, traction method. See, the traction method. Traction can be given when you hold the one person hand and then you can give the traction to realign the body. Simple. And phenomena. Manipulation of muscles, bones, ligament, joint, tendon, nerves, and etc. All the parts can be manipulated. Even he has mentioned the manipulation of blood vessels, that is called as the rakta mokshana, phlebotomy. There is a modern science say as the phlebotomy. And in opposition and stabilization, when a person to align the joint of the shoulder, hip, and spine, opposition stabilization technique can be used when a person is lying in a prone and the rest position. When the shoulder is locked with a certain movement and the elbow is rotated by holding the joints of the wrist with metacarpals and radius and ulna with the carpal bones and all the bones in the wrist and same time in the shoulder, like if it is posterior misalignment or anterior misalignment, accordingly it will be normal. And then next, it is the immobilization technique. Immobilization is the bandaging technique. 14 different bandaging technique as mentioned all over the body. When there is a ligament sprain, at least, and then I have done this pain after the manipulation of the rest, and then we put the splint and then bandage and then allow them to rest. And if it in the grade 2 till the grade 2 and severe Achilles tendon injuries, this will give a very good, fantastic results post manipulation. Whole world is beginning atlanto-occipital joint. This is a complex and important joint in the body. Sushruta mentioned lot of description about this joint in his Sushruta Samhita. Now, Western system of medicine and chiropractic and osteopathic techniques play a vital role in aligning this technique. Sushruta has explained about this manipulation in a long way in his books. See, Atlas, and this is the atlanto-occipital junction 2, which places the skull here. Okay, that is located at the site of junction of head and neck, 2 in numbers, atlanto-occipital joint. See, and Vidura. This one is the transverse process. This end. See, this end, which is connected with the n number of muscles, suboccipital muscles, and interconnecting ligaments and alar and transverse ligament to keep this strong. See, these are the two important four Marma points here, which is the most important thing in our manipulation. So we see that the modern correlation with this. Before that, Sushruta's work, he named this as the Cricketica. Located at the side of junction of head and neck, two in numbers, one on each side of the junction of the head and neck. Atlanto-occipital joint, occipit and the first cervical bone. This is the quotation he has given. Shirogrivayoho sandano cricetike tatra chal murtata, means this he has explained, and then the effect, even deafness can happen when this joint is misaligned or dislocated. See, these are the important suboccipital muscles which are connected to the atlanto-occipital junctions and CC junction. This is the 3 mm dislocation or like misalignments of atlas bone. This foramen magnum is like the spinal cord comes out, and then this causes a deficiency and the difficult for that spinal nerves and the peripheral nerves, and then this blocks at the earlier stage of the atlanto-occipital or CC junction itself. See, this one is less than 3 mm and 3 to 5 mm and greater than 5 mm. This is very critical, difficult things need surgical manipulations. As we say, like Shiva Parvati, the balance of the body, when this bone, this point, atlanto-occipital junction needs to be in a proper way, that Cricketica Marma and that second Marma, Vidura Marma. These are the 4 Marmas in this region has to be manipulated, and then it needs to be in a proper position. These the modern reference about the transverse ligaments and axis and articulations. This is the CC junction. The CC junction, cranio-cervical junction, is a highly mobile complex junction shown between the skull and the spinal column, which comprises the atlanto-occipital and the atlanto-axial joint, houses the spinal cord and multiple cranial nerves. These are the 2 ligaments. The major, there are many ligaments, and the major is alar and the transverse ligaments. These are very important role in playing stability and deciding the limits of movements. The joints are responsible for the majority of the movements of the cervical spine and different biomechanical principles. The mechanical properties of atlanto-occipital junction and atlanto-axial joints are determined by bony structures, ligamentous structures. They are more important, and it has 2 joint function togetherly to ensure the optimal stability and mobility at the CC junction. It has more connective tissues and venous supplies. See these 2 main ligaments. Before manipulating, we have there are a lot of assessment to this ligament, shear test, and all many things. You can have a reference of halar ligament test and transverse ligament test. There are a number of ligament tests you can practice before this manipulation. I will be showing the small demonstration about how to manipulate this CC junction without giving the load on the TMJ and disturbing the mandible. These are venous structures. When it is rotated, it is blocked the things. So the most important thing is the connective tissues. The connective tissues which connects all the muscles, bones, ligaments, joints together. This is the neck. When you take all the muscles, bones, ligaments, joints, nerves, and all, the neck will be looking at this. This is the picture, and then so we need to treat the connective tissues through the manipulation, through the stimulations and the release of the neck, we have a manipulation of muscles. We have a different techniques to manipulate this. All together, we have to do the manipulations. So simple technique, traction of CCJ, junction, grip and hold the hard palate, and patient position of the patient and the doctor. Patient lying and doctor's box and position and the behind. Goal to give gentle and powerful traction to the cranial cervical junction. How to see? I have shown the important 4 points, like in the cervical, how to check the points. If you are a medical person, anatomy, landmarks, and proportional measurements, body plane and nomenclature, graphical measurement method, locating by the reference adjacent points, located by classification, location by classification, finger breadth method, inch method, like method through the this is the thread measuring method. When you start practicing, this will be the very easiest method with the anatomical interpretations. So, when you want to do the treatment, if you want to do the effective treatment, if you feel that you have to find that there should not be a secondary disease or anything, we can always take the lab test whether to find whether it is a metabolic disorders or MRI helps according to the signs and symptoms, and X-rays or scans or everything will help. These are the certain X-rays we just uploaded. This one, there's a lot of cervical, see all the spondylolysis of the spine, and more like a loss of lordosis, and then you can see the spinous process. There is a twist and rotations of the spine. See the thoracic spine. See there is a misalignment and a rotation, and then see that. Osteophytes and then misalignment and rotation here. Here, see this one here. There is a misalignment I found through one of my patient in the clavicle. We must align the clavicle for the good treatment of the shoulder. For the lumbar spine, see there is a misalignment and the rotation of the spine, the spinous process. See the pubic symphysis, see this misalignment here. So we go for the demonstration, and we have our one of the model. The most thing we have to see is the patient supine position of the receiver. Giver has to stand behind, holding atlanto-occipital junction with left hand and the pulling from the right hand. I will demonstrate this with the model, and then you will get more easy. You can grab this technique easily. Okay, there are a lot of, as I told you earlier, you have to check for the ligaments. Go study about the alar ligament check and the transverse ligament check. They are so easy thing, but it is a scientific way. I just show you the techniques. Hello, host.
Yes, sir.
Yeah. Make my screen big. Yeah.
Yes, sir.
Okay. It's visible?
Yes, sir. Perfect. So, can you move slightly toward your left?
Yeah.
Like, no, this side.
Yeah.
Yes, bit more.
One second.
Yes, that's perfect.
Good.
Yes, sir.
Hi.
Yes, sir. Hello, sir.
This is this one is
Occipital.
okay. This one is atlas. We see this here. This is the
Transverse.
two
Atlantic occipital.
joint. One. Shushruta mentioned this one. Cricketica Marma. Atlanto-occipital junction.
Hmm.
It has to be in the proper position. And then this is the second Vidura Marma. Okay.
Transverse
It
process.
has to be in a proper position. Okay. For body balancing. We keep the bone here. It's visible.
Yes, sir.
Okay. Visible. See
Yes, perfect.
this junction. You need to hold this junction like hold this junction. So you have to introduce like insert two of your finger to the oral cavity and lock. This one is stable and then you need to lock with this walk stand position and then glide. Okay. In this technique, this is the traction method what Sushruta mentioned. Okay. And then in this technique, what the most important thing, we are not disturbing the temporomandibular joint. Okay, and then it gives powerful traction to the Atlanto-occipital junction. Okay, we'll go for the demo. Today our model Nadia. Our friend.
Hello. Welcome, Nadia.
I'm audible, right?
Yes, sir. Fine. Perfect.
So, like we need to hold this region, CC junction region with this grip. Okay, with this grip, and the second hold will be here on the inside the mouth. Okay, same time we need to pull this both together. And then I am in walk stand position. Okay, see, just holding lock with this. Just ask the person to breathe relaxedly. He has to breathe relax, so that before doing this technique, ask them to breathe relax so that all the muscles will be in a relaxed stage. Just hold fraction. 1, 2, 3. Relax. Just hold with the two fingers inside the art palette. Then pull. 1, 2, 3. Okay? Holding. So holding, the main thing, it has to, you need to keep the spine and head in the same line. Hold. Relax. Powerful stretch. Okay? This is the one technique. And again, relax. Hold. Just rotate. Come back again. Okay? On either side. Hold. Rotate. Relax. This is the inner. this is the, it looks simple and then it's easy if you learn. And in this technique, you just open all these stressed muscles, suboccipital muscles, and ligaments and misalignments. Everything automatically goes to its position because you are giving a space to them. Okay, so it's one of the easiest technique is the traction method. What Sushruta mentioned in this. So we will continue. This is the demonstration. Just want to show. And before doing this, contraindications are there. Like you have to check for the ligaments, function of the ligaments, function of the body, everything. So, like if you are a proper consultant, you need to assess in a different way before manipulation techniques. Okay, there are a lot of things you can do: X-rays, you can do MRI, and in condition of cervical radiculopathy also you can do this. But if you have any doubts, connect with me. I can able to discuss more on this. Okay, now we'll go for last PPTs. Okay, ma'am?
Yes, sir. Visible.
Visible?
Yes, sir.
So almost we have done 650 plus workshop plus 1000 public speech. So like these are our workshop we do with trimmers and toners and team spine action. Krishna Shah, Dr. Krishna Shah and Robin Sharma, Vikas sir helps me to flourish in this. I'm just teaching this with them throughout India. Also, we have just went to Bahrain. I was working in Canada, and we did many parts in the outside India. Conclusion, like Marma Therapy was first kind of its documented science in Indian manipulation. That's all I want to put the strong point on this. More research happening in India on Marma Therapy and Ayurvedic medicine through Ministry of Ayush India. See, like you may be whatever you may be the physician or therapist and all, like try to integrate different method of therapies which will help the individual to have a great life. That's we all are working for to make the betterment of life of the individual. So integration with the different therapies which gives benefit to the human. So we'll go for question and answers.
So that was very nice session.
Yeah.
We are having some questions from
Yeah.
our viewers. So this is the question from Dr. Akansha Sharma.
Yeah.
How can we use this therapy for supracondylar fracture?
So it is a different case study. I cannot say this.
Yeah.
It's a long process. Please ask sir to connect with me and then with the case, so I can able to discuss with him. Okay.
There is another question. How Marma therapy is different from various other type of therapies?
See, like it has internal medicine, it has external medicine, it has manual therapy, it has manipulation therapy. Because when you give a traction, the body itself is aligned. And if there is any dislocation, we can use the opposition stabilization technique. And then more another one, the gifted thing is we have a bandaging technique. So to enhance the post, if you have a ligament injury, grade 2, more than grade 2, the 75% of ligament is injured, we can do after the manipulation, we can do a bandaging technique, and then there are certain time limits according to the injury, and that heals by itself. If it is like grade 2, it heals a lot, and then it gets supports from the other part of the bodies, and then it helps a lot. So like we have additional of these things together. Yes.
So, does it include visceral manipulation in
Yes.
Marma Therapy?
Yes.
Yes, ma'am.
Yes.
Sir, can you show any technique for trismus, the TM joint stiffness?
TMJ. Yeah. It's your wish or
My wish.
okay. I have to go back again. Stop screen sharing.
Yes, sir.
Yeah.
Please. Actually, sir, I'm dealing with some cancer patients also, na. So they are mouth cancer patient. They are having this problem.
Ready? Right, visible.
Yes, sir.
See, first, if you want to, before manipulating, see, just check for the knotted muscles. Okay, you just stimulate outside, same point you go inside and then rotate and manipulate. Okay, just to stimulate. And Sushruta's opposition and stabilization technique. I'll just show that. Visible?
Yes, sir.
Okay. Okay. This joint, mandible, need to lock. Okay. Give the opposition pressure. Same time, she has to ask her to close. Close. Okay. Same thing. Open. Here, this side you cannot see. See, same thing.
Hmm.
Hold, and then this side opposition. Hold. Close. Same thing.
So,
One
what should be the vector of force?
vector of force is see, you have to just hold.
Hmm.
Okay.
Hmm.
You have to hold the temporal bone on the one side.
Hmm.
You need to hold the temporal bone on the one side,
Hmm.
and then you have to hold the mandible.
Mandible.
Okay. On the same time, don't go for the force. Okay. Do not go for the force. Just hold firmly, and then ask them to close the mouth. Okay. The force has to be from outside to inside. You should not press. You have to hold firmly, right? Just hold. Same time when the patient close the mouth, it will be like close, going inside. Just it goes by the body movement, right? And another technique, just hold the lower jaw, relax. Just pull,
Alright.
okay? Pull 5 times with the proper breathing, and then hold. This is the hold for the chin. Opposition and stabilization. Hold. Okay. Chin has to be inside. Okay. 2 finger on the mandible. Open. See, just hold. Don't press, give any force. Just hold. Close. Open. Close. It goes, it aligns by itself. Okay? We have like another 7 to 8 techniques. Like, this is
Yeah,
another.
it was very nice technique.
Sorry for Nadia, we just I asked her for one technique.
Oh, thank you, Nadia. Thank you so much.
So again we'll go.
So does Marma therapy include any kind of relaxation techniques?
Yes. Yes, ma. Different points I showed. There are like a lot of different points which is connected directly to this Adipati like Vedma here. If you relax, it gives like more relaxation, and then we have more points in the body. Upper like 107 points are there. It is directly connected to release the muscle immediately. We go deep science, like it will be like walks through the meridians, myofascial meridians, kinetics, and everything. Like it's not. It's like a ocean. It's like too many interpretations are there. Many research are going in India. Many published papers are there. You can go to the website of Ayush Ministry and then you can see.
So definitely. Wait a minute. Questions, sir? So how Marma therapy can be useful for any tips as a therapist for a budding physiotherapist?
Like
How can they incorporate it in their routine practice?
thema, like name only different, but everything we are treating in the body only. See, if you see, like, if you see, go through the literature and see, like, Atlanta occipital, cricketica Varma, you cannot able to understand. We made a lot of interpretations, and then we found that it is directly connected to the Atlanta occipital junction and transverse ligament and alar ligament, the second two Marma points. All 107 Marma points are directly connected with this. So, like, it is a kind of external therapy also. Like, in all the medical fraternity, like only physiotherapists treat without anything in their hand. They treat without giving medicines. They are increasing the healing energy of the body. Okay? Only physiotherapists or without any instruments, natural technique. They forgot, like they treat without anything. They are without any harm. That how the body is getting treated, it is enhancing the natural healing energy. You can integrate all these things. If you want to learn, they are welcome. If they want to chat or to have a very good detail, they want to know about the more detail about Marma therapy, I am here to help them for case discussion or anything. Like for they want to know about small like what all the important tips we can add to our things. I can be able to give, and they are always welcome. I can be easily, I will share my phone number here, and then you can able to connect with me, or like our team members will be the Krishna Shah in our page, Traumas and Pronus page and Spine Actions page. You can get connected with me anytime, and then can help.
So I have one question. So the technique you showed for Atlanta occipital joint, does it allow if the patient is having a disc bulge in a lower cervical region?
Disc bulge, there are so many things. Disc bulge means like lower cervical region. If it is the segmental base, right? we need to understand the nerve root innervation. If it is like more than C3, C4, C5, it is anything like this protrusion also we can do in this junction and then maintain the force. Okay, segmental. You can manipulate segmental. Okay.
Thank you so much, sir. That was very nice, very informative, and very, evolving and new concept. Like most of many people don't know about Marma therapy.
Not a new concept. This is a very olden concept of,
Yeah, but still, sir, it's not that, highlighted.
yeah, that's we can say like because like the problem with our fraternity is like oh, I'm an ayurvedic doctor, I'm a physiotherapist, I'm a dentist. No, we need to learn. I learned with so many of TMJ, with interpretation with so many dentists, and then I was sharing with my notes and then my knowledge with them and then learning. It is an integration has to be done. The main part of bringing this Marma therapy is our own motherland. India has lots of manipulation and medical treatment, and then we need to document more thing now. And then it is time like our Ayush ministry is helping a lot. And then thank you so much, and thanks for the global outreach platform to so this techniques, and then this is a very good platform for our tremors and toners and spine action to reach out to more people.
Yes, I know about that spine action team and all.
Yeah.
Because nowadays, osteopathy and chiropractic is like emerging now in India. It's evolving, but still, Marma therapy is like lots of people don't know about. But today, so it was very nice and very informative session, and we
Thank
are having lots of views on our live Facebook page.
you.
And I thank you again on behalf of Global Outreach Medical and Health Association. And I personally would like to connect with you in future for any of my
Thank,
patients related query. Thank you so much, sir.
yeah, yeah. Thank you, ma.
Thank you. Sir, take care and good night.
Yeah. Good night, ma.
Good night, sir.
Bye.